The College of Nurses of Ontario presents Medication Practice Standard, an overview. When you read the Medication Practice Standard, you'll notice that it is a short, principle-based document. This principle-based standard requires you to use critical thinking and your knowledge, skill, and judgment when making a decision about a medication practice. The document gives you more flexibility to respond to clients with a broad range of healthcare needs. This webcast will explain what principle-based means and the 3 principles included in the standard. After watching this webcast, you should be able to do the following. Understand how key concepts from nursing practice will help you apply a principle-based document in your medication practice. Understand your accountability when applying the principles and expectations that are discussed in the Medication Practice Standard. A principle-based document uses broad statements that encourage healthcare providers to use professional judgment in making practice decisions. The Medication Practice Standard uses common nursing principles to guide your practice. It outlines your accountability and responsibility for using professional judgment, which are key to the nursing profession. The standard builds on entry-to-practice competencies that you are required to use throughout your career, no matter what your role or practice setting. You will need to use the following competencies when applying the Medication Practice Standard: critical inquiry and evidence-informed practice. Critical inquiry expands on the concept of critical thinking, which is an entry-to-practice competency for registered practical nurses. It simply means asking good questions and reflecting on your practice when making decisions. Evidence-informed practice means using research when you make practice decisions. Using research to inform your practice will help you find strategies to improve your client care. You can find helpful information from a variety of sources, such as the client's perspective of the care, national guidelines, policies, expert opinions, and quality improvement data. Commonly referenced sources include the Institute for Safe Medication Practice, the Canadian Patient Safety Institute, and Health Canada. For more information on these practice competencies, please watch our Critical Inquiry and Evidence-Informed Practice webcast. The Medication Practice Standard focuses on 3 main principles: authority, competence, and safety. Each principle has a statement that outlines the expectations for nurses. We have included 3 decision trees to help you apply the expectations for medication administration, dispensing, and determining if the order is clear, complete, and appropriate. The standard does not repeat information that can be found in other college practice documents. You must refer to other practice documents to support it. For example, use the Authorizing Mechanisms Practice Guideline when looking at requirements for orders, or refer to the Documentation Practice Standard when determining what you need to document in your medication practice. We will now look at the first principle: authority. The statement for authority is: nurses must have the necessary authority to perform medication practices. The authority principle provides information about when an order is required and what to look for in an order. Orders for medication can be direct orders, which apply to one client, or directives, which apply to more than one client. However, orders for controlled substances must be direct orders. The practice standard states that when you receive a medication order that is unclear, incomplete, or inappropriate, you must not perform the medication practice. How do you decide if an order is unclear, incomplete, or inappropriate. You can use this decision tree, which is included in the practice standard. Working through the questions will help you determine whether the order that you are assessing is clear, complete, and appropriate for your client. The second principle is competence. The statement for competence is, nurses ensure that they have the knowledge, skill, and judgment needed to perform medication practices safely. This principle refers directly to the nursing concept of evidence-informed practice. The Decisions About Procedures and Authority Practice Guideline states that nurses ensure that they are competent in both the cognitive and technical aspects of a procedure prior to performing it. This means that everything you do is based on evidence. As research provides new evidence, you make changes to your nursing practice. An example is using evidence to know that a medication is appropriate for your client and following up if you are concerned. The final principle is safety. The statement for safety is, nurses promote safe care and contribute to a culture of safety within their practice environments when involved in medication practices. Once again, you will be using the concepts of critical inquiry and evidence-informed practice to meet the requirements of this principle, such as providing client education, collaborating with the healthcare team and experts, and advocating for system approaches to support safe medication practices. There are reliable external resources that provide direction on safe medication practice, such as the National Coordinating Council for Medication Error Reporting and Prevention, Canadian Institute for Health Information, and Accreditation Canada. You will also find a number of college resources to help you. Practice documents, including the ones we referenced in this webcast, are available on our website. Other educational tools, such as webcasts, Ask Practice, Frequently Asked Questions, and learning modules are also available on the website. If you have questions about this webcast or the medication practice standard in general, please contact the college. We would like to know what you think of this webcast. Please use the Evaluate this webcast link to send us your feedback.